For more anatomy related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, in this video we'll discuss about esophagus. So from today onwards we'll discuss about the other structures which are involved in the digestive system. So by the previous video we have completed the anatomy of the oral cavity. So what is the esophagus? Esophagus, it is also called as the food pipe. That is, it is the pipe through which the food travels to the stomach, and it is about 25 centimeter long. It extends from the lower end of the neck to the upper end of the abdomen. So it extends from the lower end of the neck to the upper end of the abdomen, and it is about 25 centimeter in length. And it is flattened anteroposteriorly. It is flattened anteroposteriorly. And the wall of the esophagus, it is kept collapsed most of the time except during the intake of the food. That is, during the intake of the bolus it gets dilated, but most of the time the lumen of the esophagus, it is kept collapsed. So the esophagus, it extends from the lower border of the cricoid cartilage. In this figure you cannot see that. So it extends from the lower border of the cricoid cartilage, then it descends downwards anterior to the vertebral column. That is, esophagus, it is seen anterior to the vertebral column. That is, vertebral column is seen posterior to the esophagus. So it descends downwards anterior to the vertebral column, and it passes the superior mediastinum as well as the posterior mediastinum. That is the mediastinal space, that is the space between the lungs. It is mediastinal space, and it is divided into superior and the inferior mediastinum. So it descends downwards through the superior mediastinum as well as the inferior mediastinum. That is, the inferior mediastinum, it is again divided into anterior mediastinum, middle mediastinum and the posterior mediastinum. So the middle mediastinum is the space in which the heart is located, and posterior to it is the posterior mediastinum. So it descends first downwards through the superior mediastinum and then through the posterior mediastinum, and then it joins with the upper part of the stomach at the cardiac end at the level of the 11th thoracic vertebra, and it pierces the diaphragm just at the level of the 10th thoracic vertebra. So now we will discuss the curvatures of the esophagus. Although it is a vertical tube, it has got slight curvature from side to side. So the two curvature, one is at the upper end near to the root of the neck and the other is at the lower end. So thus there are two side to side curvature, and there are anteroposterior curvature also. It is according to the cervicothoracical spine. So these are the curvatures of the esophagus. That is, two side to side curvature, one at the upper end near to the root of the neck and other at the lower end, and the side to side and the anteroposterior curvature, that it corresponds to the cervicothoracical spine. So now we will discuss the constrictions of esophagus. So what do you mean by constriction? It is the tube, the esophagus tube, it becomes narrower at certain areas. So that is the constrictions. So mainly there are 4 constrictions for esophagus. So the first constriction, it is nearer to the upper end, that is 6 inches from the incisors. So first constriction, it is 6 inches away from the incisor teeth, where it is crossed by the cricopharyngeal muscle. So the first constriction, it is 6 centimeter away from the incisor teeth, and it is at the area where the cricopharyngeal muscle crosses the esophagus. Next constriction, it is near to the arch of aorta. That is, it is about 22.5 centimeter away from the incisor teeth. So next constriction, it is about 22.5 centimeter away from the incisor near to the arch of aorta. The measurement of esophagus, it is only about 25 centimeter, but when you take the measurement from the tip of the incisors, it is about 27.5 centimeter. So next construction, it is 27 centimeter away from the incisor teeth at the when it is crossed by the left bronchus. So it is 27.5 centimeter away from the incisor teeth. The total measurement of the esophagus, it is only about 25 centimeter, but the measurement is slightly higher because the measurement of the oral cavity, that is the length of the oral cavity, is also included in this measurement. So it is slightly greater. And the last construction, it is a construction where the esophagus, it pierces the diaphragm. So it is about 37.5 centimeter away from the incisor teeth. That is, it is about 37.5 away from the incisor teeth, that is at the piercing of the diaphragm. So these are the four construction. One is near to the upper end, that is 6 inches away from the incisor teeth, and the next is near to the arch of aorta, that is 22.5 centimeter away from the incisor teeth. Next is near to the when it crosses the left bronchus, that is about 27.5 centimeter away from the incisor teeth. And last construction, it is when the esophagus pierces the diaphragm. So these are the four constructions of the esophagus. So this measurement is very important because it is usually used when an endoscopic device is inserted through the oral cavity. So now we will discuss about the relations of the esophagus. So today we will discuss about the relations of the thoracic part of the esophagus. So anteriorly it is related to the trachea. So this is the trachea and posterior to it is the esophagus. So anteriorly it is related to trachea, the right pulmonary artery. So this is the right pulmonary artery. So it is also related to right pulmonary artery. The left bronchus, this is the left bronchus, it is related to left bronchus. Pericardium with left atrium. So in this figure you cannot see that. So it is also related, anteriorly related to pericardium and also the left atrium and also to the diaphragm. So these are the anterior relations of the thoracic part of the esophagus. So it is related to trachea, the right pulmonary artery, the left bronchus, the pericardium with the left atrium and also to the diaphragms. These are the anterior relations. So now we will discuss the posterior relations. So posteriorly there is the vertebral column. We have already discussed. So the esophagus, it is seen anterior to the vertebral column. So posteriorly it is related to the vertebral column. Right posterior intercostal arteries. In this figure you cannot see that. Next, the thoracic duct. So this is the thoracic duct. So it is posteriorly related to the thoracic duct. Azygous vein. So this is the azygous vein. So it is also related to azygous vein. And thoracic aorta. So this is the thoracic part of the aorta. So it is also related to thoracic aorta, right pleural recess and also the diaphragm. In the lower part it is also related to pleural recess and also the diaphragm. So these are the posterior relation, that is the vertebral column, right posterior intercostal veins, the thoracic duct, the azygous vein, the thoracic aorta, the right pleural recess and also the diaphragm. So these are the posterior relations. The diaphragm, it is related anteriorly and posteriorly because the esophagus, it pierces the diaphragm. So it is related anteriorly and posteriorly to the diaphragm. Next is the relations to the right. To the right, there is a right lung and also the right pleura, the azygous vein and also the right vagus. So these are the right relations. Next is the left. To the left, there is the aortic arch, that is the arch of aorta, left subclavian artery, the left subclavian artery, the thoracic duct and left lung and also the left pleura, left recurrent laryngeal nerve, the descending thoracic aorta, and the left lung and the mediastinal pleura. So these are the left relation, that is the aortic arch, left subclavian artery, the thoracic duct, left lung and the aorta. Here you cannot see that there is a left lung and also the pleura, left recurrent laryngeal nerve, the descending thoracic aorta, the left lung and the mediastinal pleura. So these are the left relations. So now we will discuss the arterial supply. So the cervical part, so the esophagus, it has the cervical part, the thoracic part and also the abdominal part. That is the cervical part, thoracic part and also the abdominal part. So the cervical part, it is supplied by the inferior thyroid artery. Cervical part supplied by the inferior thyroid artery. The thoracic part, it is supplied by the esophageal branch of the aorta. So thoracic part supplied by the esophageal branch of the aorta, and the abdominal part, it is supplied by the esophageal branch of the left gastric artery. So these are the arterial supply. Next is the venous drainage. So the upper part of the esophagus, it drains into brachiocephalic vein. Upper part, it drains into the brachiocephalic vein. The middle part, it drains into the azygous vein, and the lower end, it drains to the hemiazygous vein. So next is the lymphatic drainage. So the lymphatic drainage is the cervical part, it drains into the deep cervical nodes, and the thoracic part to the posterior mediastinal nodes. So the cervical part, it drains into the deep cervical nodes, and the thoracic part to the posterior mediastinal nodes, and the abdominal part to the left gastric nodes. So cervical part to the cervical lymph nodes, thoracic part to the posterior mediastinal nodes, and the abdominal part to the left gastric nodes. So today we discussed about the anatomy of the esophagus. So it extends from the lower part of the pharynx to the stomach. So it is about 25 centimeter long and it is flattened antero-posteriorly. And then we discussed about the relations of the esophagus, that is the anterior relation, posterior relation, relations to the right and also to the left. And then we discussed about the arterial supply, the venous drainage, the nerve supply and also the lymphatics. So this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.